We can have one that it's called occult sarcoid, where the affected skin area was hairless, of the hair was altered in quantity, density, color, and reduced length, like in this case. We can find small subepidermal miliary nodules or plaques within the affected regions. We have another that is the verrucous sarcoid. The skin is alopecic, is thick, and has an hyperkeratotic appearance with extensive flaking of the surface of the epidermis, as you can see in this picture. Small or more extensive areas of ulceration are present in many cases, and miliary nodules can be palpated within the affected skin. They had a warty appearance, that's why the name. Nodular sarcoid, two types are recognizable. Both are solid, are spherical or ovoid, and have a well-defined palpable outline, as you can see in both pictures. Nodular type are entirely subcutaneous with no apparent epidermal component detectable by palpation. And like in this case, nodular type B have varying involvement of overlying skin. The overlying of adjacent skin often shows typical verrucous or occult changes. This nodular sarcoid was treated with BCG, that is the vaccine against tuberculosis, calmette-guerin bacille. So I injected in the area of the sarcoid. They were 6 sessions. Here in Mexico, you can find in a drugstore the vaccine. I apply 1 doses every week, and I made it by 6 sessions. And you can see the difference. The result is really great. We do not have more sarcoid. We have fibroblastic sarcoid. It's fleshy, ulcerated appearance. Type 1 sarcoids are pedunculate with a limited or faint base. Palpable within the skin is the worst kind of fibroblastic for me because it looks very aggressive, very awful, very bloody. Type 2 are a broader based without a recognizable pedicle and often have a diffuse, ill-defined margin with significant thickness, palpable beyond the obvious margins of the lesions. These are the most difficult type of sarcoid to be controlled. You can see it's heavy. We decided to remove because this was in the eyelid but was involved in conjunctiva too. And we had a mixed sarcoid. Individual lesions have the characteristics or 2 or more of the other more defined types. Various mixed lesions are encountered, but most involve both nodular and verrucous components. What about the treatment? Surgery has poor prognosis, surgery alone. Preservation of tissue and its function is the objective of the surgery. We can find it sometimes in some places that are very difficult to cut. We can leave and scarring and deformity. BCG, immunomodulation, as I show you, imiquimod, cryosurgery, hyperthermia, chemotherapy, and in some cases, like in this one, interferon alpha. After 4 sessions, you can see that it's improving very well. Now, squamous cell carcinoma. This is a more frequent tumor in eyelids. It's very aggressive. We know that we have a component of the rays ultraviolet, and they cause pain